Hi, my name is Sandy Curtin. I'm going to talk to you now about bone marrow transplantation for MDS. What is a bone marrow transplant? A bone marrow transplant, also known as a stem cell transplant or hematopoietic stem cell transplant, is a multi-step process used to deliver high doses of chemotherapy and sometimes radiation. This will make room for infusion of stem cells used to repopulate the bone marrow with healthy factory cells. It provides the only potential cure for MDS. There are significant risks with this form of treatment. For this reason, there are criteria for which MDS patients are likely to benefit from and tolerate this type of treatment. There are different types of bone marrow transplants based on the source of donor cells. In an allogeneic stem cell transplant, these cells are obtained from another individual who is genetically as similar to the patient as possible. This can be a sibling or an unrelated volunteer donor. Autologous stem cells are obtained from the MDS patient themselves and then reinfused following the high-dose chemotherapy. For MDS, allogeneic stem cell transplants are most common, as this is the only way to replace the abnormal MDS clone. Determining whether you're a candidate for a bone marrow transplant is a very detailed process. Your provider and healthcare team will evaluate several factors known as eligibility criteria to see if a bone marrow transplant is right for you. The most common eligibility criteria include age less than 65 years, with some exceptions at some centers, availability of an HLA identical matched donor, good heart, lung, liver, and kidney function, and there are a number of tests that will be completed to confirm these eligibility. Being physically active and able to perform daily activities independently, and the consistent availability of a caregiver. The bone marrow transplant process begins with the pre-transplant evaluation. The pre-transplant evaluation process and treatment process includes a couple of things. It is always best if your MDS is well controlled prior to proceeding to transplant. This will require disease-modifying therapy. You can learn more about disease-modifying therapy in the Building Blocks of Hope program. The transplant evaluation includes consideration of eligibility criteria, and you will continue your pre-transplant evaluation and treatment while a donor search is started. The donor search includes evaluating any possible sibling donors, and if there are no sibling matches, a donor search will be initiated. This may take days to months, and in some cases a suitable donor cannot be located. The best donor will match all of your DNA markers, otherwise known as 12 of 12. In some cases, donors who match most but not all of the DNA markers will be considered. This type of transplant is known as a donor mismatch and does carry greater risk. Once you have been identified as an appropriate transplant candidate and a donor has been located, you will have a pre-admission consent signing. This visit usually takes more than 1 hour and will include a detailed discussion of the possible risks and benefits of the transplant for you. It is important to prepare any questions that you or your caregivers may have prior to this visit. If you wish to proceed with the transplant, you will sign a consent form prior to being hospitalized for the transplant itself. Once the pre-transplant process is completed, you will be hospitalized for the bone marrow transplant. A date for admission into the bone marrow transplant hospital unit will be determined based on the pre-transplant screening process, donor availability, and other factors. This treatment phase requires hospitalization at the bone marrow transplant center, usually for several weeks. Your conditioning regimen, or the high-dose chemotherapy, will be administered during this period of time. This is necessary to remove the remaining elements of the bone marrow which carry the MDS clone and make room for the donor cells. Some patients will also receive radiation therapy. The stem cell infusion, the actual transplant itself, is known as Day 0. This follows the administration of the high-dose chemotherapy and possibly radiation. The donor stem cells are infused via a central venous catheter. The actual infusion can take as long as an hour depending on the number of frozen bags of stem cells. These cells are preserved in a solution that may have a smell of garlic. There are commonly other treatments as a part of the stem cell infusion, such as hydration, that will result in a day-long procedure. Once you've received the stem cells, you will wait to have what's called engraftment. Engraftment is defined as repopulation of the bone marrow by the graft. Your transplanted bone marrow is considered to be engrafted when the absolute neutrophils are greater than 500 for 3 consecutive days or greater than 1,000 for 1 day. We'll also need to see the platelets above 20,000 independent of any transfusion for at least 1 week. The time it takes for engraftment is variable. During this period of time, there are a number of potential side effects. Those that are early onset include cytopenias. This occurs as a result of the high-dose chemotherapy and for those receiving radiation therapy. Gastrointestinal side effects such as nausea, vomiting, and mouth sores or diarrhea. Certain infections during the time that your blood counts are low, and you have cytopenias. These may require the administration of antibiotics and other supportive care and transfusions. There are those side effects that are later in onset, including graft versus host disease and organ-specific late effects. It will be important for you to ask questions about these in your pre-treatment consent signing. Once you've been identified as a good transplant candidate, you'll need to select a bone marrow transplant center. There are more than 200 transplant centers in the United States alone. Finding one that best suits your needs may seem like an overwhelming task. The choice of centers may be based on a number of factors: the recommendations made by your primary oncologist, the transplant centers under contract with your insurance plan, the rating of the individual center, and the proximity of the center to your home. A directory of blood and bone marrow transplant centers can be found online at a number of resources that are listed here for you, and additional resources are included in the Building Blocks of Hope program. What questions should you ask about the bone marrow transplant? There are a number. Is the facility approved by insurance company or for transplant? What is covered by your insurance? And what are the out-of-pocket costs? Is the program accredited by the Foundation for Accreditation of Cellular Therapy, or FACT? What test will I need before the transplant? Is housing available in the area for post-transplant care? And what is the recommended or required duration to reside near the transplant center? What is the experience of the transplant team in treating patients with MDS? Additional questions: is there extra financial support available from the institution for treatment not covered by my insurance? What is the usual length of hospital stay during transplant? How often will I need to be seen in the clinic after discharge? Does the transplant program have a long-term follow-up program to help with medical issues that may come up months or years after transplant? Are there emotional support services for me, my donor, my caregiver, and my family? What is the center's success rate with stem cell transplants? And what are the expectations for the caregivers? All of these are important to organize your thoughts as you proceed toward the transplant process. You can learn more by exploring the Building Blocks of Hope and finding additional resources in print and online discussing elements of the bone marrow transplant process.